My name is Emily,
And I'm Key.
and we are advocates for
Have you heard of physician-assisted suicide?
No, I haven't. What is that?
It's the voluntary termination of one's life by the administration of a lethal substance with the direct assistance of a physician.
Really? In other words, it legally allows a doctor to end the patient's life who has no longer than 6 months to live.
It's a very big trending topic currently due to the fact that it's only legalized in 5 states in the U.S., which are Oregon, Vermont, Washington, Michigan, and California. And us as advocates, we're trying to spread awareness. That way we can get it legalized nationally.
Oh, okay. Well, that makes sense. So there are 4 primary arguments for legalizing physician-assisted suicide. They are the mercy argument, which states that the immense pain and indignity of prolonged suffering cannot be ignored. We are being inhumane to force people to continue suffering in this way. The patient's right to self-determination. Patient empowerment has been a trend for more than 25 years. It's their life, their pain. Why can't they get the treatment they want?
So they're killing themselves legally?
Yeah, they're killing themselves legally. Well, like they're suffering, so like they want to end their life, and they.
I'm an advocate for physician-assisted suicide. Why? Because I believe in people's rights. Many people argue that physician-assisted suicide is like murder and suicide coincided. This, in fact, is miscalculated. Hey, do you have a second?
Yeah, sure.
I'm an advocate for physician-assisted suicide, and we're going around asking a few questions regarding your opinions.
Okay.
So, are you aware what physician-assisted suicide is?
Kinda, yeah.
Alrighty, so in the U.S., they have allowed 5 different states to practice physician-assisted suicide. Do you believe that the rest of our country should allow this?
Well, yeah, I do think so because I feel like it should be in the decision of the person who wants to suicide and the physician.
Thank you, sir. So, Eric, how do you feel about physician-assisted suicide?
I'm not really familiar with the subject. Can you elaborate on what it is?
Physician-assisted suicide, also known as euthanasia, it's like when a terminal ill patient is seeking physician help in order to hasten their death through like lethal doses of anesthesia, other stuff like that.
Well, my opinion on it is, I feel the only people who are elderly and are really sick, like have life-threatening cancers, they should be the ones allowed to take these anesthesias or these prescription pills or any kind of medicine that will help them pass on. But I feel people with depression, it shouldn't be. It should kind of be a barrier for them because depression can be overcome, unlike cancer or life-threatening cancer, where there's a small percentage or small chance of
So I see.
overcoming it.
I see. You're saying there should be some type of requirements indicated. Alrighty. So currently in the U.S., 5 states have legalized physician-assisted suicide. Do you believe that it should be legalized across our nation, or stay in only those 5 states?
What are those 5 states?
California, Michigan, Washington, Vermont, and Oregon.
I feel like if they're allowed in these states, they should be legalized across the nation. But again, with those barriers that I touched on earlier.
Alright. Thank you for your time today, Eric.
Thank you.
Problems with patients committing suicide and physicians partaking in illegal activities within the hospital is still occurring due to the pre-existing laws preventing the practice of physician-assisted suicide in the state. States banning physician-assisted suicide claim it is deemed unethical and unjust. However, not legalizing the practice of physician-assisted suicide is more unethical and inhumane. These laws take away the rights of the terminally ill patients and have all the options available for them to choose from. All terminally ill patients should have the choice to hasten their death and not have to endure the suffering and pain of the last stage of their life.
There's no need to fear death. Most of us don't take that time to analyze it. We just put it off to the side, but sooner or later it would be time to face it. Brittany Maynard was an American woman with terminal brain cancer who decided that she would end her life when the time seemed right. She was an advocate for the legalization of aid in dying. She moved from California to Oregon to take advantage of Oregon's Death with Dignity law, saying she decided that death with dignity was the best option for her and her family. She partnered with Compassion and Choices, an organization dedicated to the care and rights of terminally ill patients, including those seeking physician aid in dying. Compassion and Choices helped to create the Brittany Maynard Fund, which seeks to legalize aid in dying in states where it is now illegal. It was reported on November 2nd, 2014 by People magazine and other various media sources that Brittany Maynard had ended her life on November 1st, 2014, surrounded by her loved ones.
According to Brittany Maynard, who had glioblastoma, she decided to take lethal medications from her doctors. As she described, "It's not a single cell in my body that does not want to die, but my disease is going to kill me." Her situation places her in many other people's, where they are necessarily, either due to disease, injury, placed in the hospital and are about to die, and they choose to because their quality of life is deprived. So this cure, implemented on a federal level, would allow people such as Brittany to die in a peaceful and dignifiable way and not wait around for their disease, injury, or certain circumstance to kill them and pass away peacefully.
Over the years, many terminally ill patients have not been given the option of physician-assisted suicide due to it being banned from all states, except for 5. Physician-assisted suicide needs to be legal in all 50 states so the patients can no longer suffer, nor them nor their families. People that have lost a loved one often say that they wish that they could have said goodbye, or that they wish they knew they were going to die so they can have their last moments with them. It needs to be legalized so their families, like their children, don't see them suffer no more. I wouldn't want my daughter to see me unhappy or suffer from pain. It would be beneficial for the family because it wouldn't be a sudden death and they could start earning money for any funeral costs. It would be like their last wish.
It is argued that the right to die respects the individual's right to self-determination or his right of privacy. Interference with that right can only be justified if it is to protect essential social values, which is not the case, where patients suffering unbearably at the end of their lives request to die when no alternatives exist. Not allowing the right to die would come down to forcing people to suffering against their will, which would be cruel and a negation of their human rights and dignity. Every person has a right to live, with at least a minimum dignity.
So what did you guys find out about physician-assisted suicide?
You show me there's something more to us, and the same old thing, no usual